while I love applications of federated data, I do like to be a bit pithy sometimes. So I've done a version of this presentation before, and it was called "Don't Share Your Data," which, coming from an open source and open data champion in public health, is a little bit provocative, and that is exactly the point. So what we're going to get into here is is, and this is the bottom line up front. There's a couple of things that we can do, and there's a couple of learnings that I think that we've had over the past number of years that can actually help us in imagining a better public health data ecosystem and health data ecosystem. So, number one, stop sharing data. Instead, think about enabling access, and especially at the public health level, where we are often not interested in, specific primary care delivery. Well, I'd say almost always, but where we care about aggregates, we care about population trends. This can be extraordinarily powerful. So how do we actually set up architecture to do that better? The second big thing that I'll be putting forward is that data stewardship or data management is no longer kind of the way we need to be framing stuff. Folks traditionally in government, especially like data custodians, data managers, their job has been to lock data down, to make sure that it's going to be secure. If nobody can touch it and if no one can see it and no one knows it's there, then you're as secure as you can be. Data stewardship flips this on its head a bit and says that you are responsible to ensure that data is creating value. And there is local value, but this will come as no surprise to anyone working in public health, secondary use, researchers, academia. There's ancillary value that we really need to move forward with unlocking, and that can really help to transform our systems. And three, and I kind of mentioned it a little bit, a lot of the things that are currently stopping us from sharing or providing access to data aren't necessarily issues depending on how we architect our data systems. So these are kind of three threads you're going to kind of hear and see about, or hear about and see as we go through the presentation. And hopefully it's useful and entertaining, and I really look forward to your questions at the end. So in health data, we've got a number of challenges, right? And again, none of these are going to come as any surprises to you. We have organizational silos, so it's hard to move data between jurisdictions, sometimes between organizations within jurisdictions, sometimes within just two different parts of organizations. We've got fragmentation in the people that actually need access to the data. We've got primary healthcare providers. We've got data entry clerks. We've got data analysts. We've got data engineers. And all of these different people need different parts of the data or put fingerprints on different parts of the data at different points in time. We often will set up boundaries, like hard boundaries that inhibit sharing. We will procure an EMR system or procure a data system or develop our own data system without actually thinking about what if we do want to share this, right? And then that becomes extra costs or extra development time, which are all barriers to actually getting data into the right hands to do things to help people. And then we often have lack of standards. So again, where, if you're looking across Canada, like we effectively have tens of thousands of different data systems, right? Some of them might be on paper. Some of them are like small kind of boutique. You're a doctor, you've got a private practice, or you're in practice with a couple of other people. You're running a physiotherapy organization. All of these are data systems, and they are developed based off local business need, often without thinking about national or international standards. So that also makes it very, very hard. So all of these things contribute to a highly fractured, highly siloed data ecosystem around health and public health data that inhibits our ability to actually know what's going on, to make better decisions, to understand what's happening, and frankly, to do our job. So it's important to understand that these silos actually appear for really valid reasons, right? There are jurisdictional boundaries. There are laws, there are regulations that govern how data can be used and shared. You've got different levels of technical knowledge across different organizations. You've got different local business needs. You've got incentives around electronic medical record systems to set their systems up in a way that will build market share, right? Which means they don't want their systems to be interoperable necessarily with other systems. So all of this, plus kind of the very real threats to cybersecurity in hospitals and beyond, means that like these things make sense. So if we start from that perception and understanding, and then we start to figure out, okay, well then with understanding that, how do we go forward? How do we actually start to understand? And one of the important ways is articulating what this actually costs. So looking at this, right, all of these siloed systems create massive problems for us in actually delivering the integrated care that people need, right? Humans, like everything that happens, my mental health impacts my physical health. My dietary habits impact my physical health and my mental health. Everything that happens to us happens around in a very complex system. The need to actually understand one more than one part of it is often very hard to put into practice, right? So if I go into an emergency room, maybe I'm unconscious. Who's going to know what my health history, what my physical history is, my genetic history, all of this stuff? So it can become very, very hard for us to actually enable healthcare professionals to do their job within each of these specific contexts because of the silos that exist. And it makes it harder and harder. And this generates ongoing kind of knock-on costs within our system. Because a doctor, before he sees me, now needs to get data from 5, 6 different systems. That means more time is required in kind of like data scanning and research. This means that less time is available for, spending time with family, and the knock-on effects kind of move across our system. So I don't think we can actually understate how much harm the lack of integrated data systems does to us, like over time, over the country, and over just kind of like the span of each and every human life that's out there. So the opportunities, though, are kind of the flip side of this. Like, what if we actually had interoperable data across these systems that enabled this integrated patient care, right? What if we had it set up in a way that right from data collection, we were planning for the movement of data across systems. And this would include things like accounting for OCAP principles and indigenous data sovereignty, not just looking at personal privacy, but looking at community privacy, building that into our systems, but planning for parts of the data to flow up, through these communities into jurisdictions, and then eventually at the federal level or the national level or the international level. Like there's ways that we can do this. And in doing this, that both enables the actual provision of health services as well as the public health lens, understanding what's happening, understanding where interventions and policy changes are required, and actually building those into our system. So this is the dream. The good news is our environment's been changing. A lot of the stuff that I talked about, like the very reasonable reasons, right, that we have all of these silos, doesn't always apply today. And a lot of the things that we have, so when you were starting off, if you had a practice in the 90s, like you needed to have a server on premises if you had a database or you had an Excel file, right? Everything was siloed because there really wasn't another option, right? We didn't have kind of massive internet and connectivity. We didn't have cloud systems. We had computers that were much more limited. So all of these things meant that this was the way it had to happen. The opportunities today in cloud systems, in massive connectivity, in advanced analytics, and the ability to more easily ask questions, like each of these things alone gives us new opportunities, right? And new possibilities in improving health systems. Together, and especially when you start to factor it into like growing movement around the international patient standard, right? Like the international patient summary, um, growing standards around just how we're classifying vaccinations, right? So you've got the SNOMED codes and all of these things. Each of these pieces starts to kind of fit together. We currently have, or I'm going to say like a year and a bit ago, we had a thing called the Working Together Agreement that was signed, where each and every jurisdiction, province, territory, and the federal government across Canada agreed to put funding into the system. And one part of that agreement was that we would actually work towards interoperable systems that would both improve patient care as well as provide that public health data layer so we could respond to things like COVID. And another part of this, Bill C-72 is currently moving through, and this is actually enforcing data blocking prohibitions in vendors. So it's making it so that vendors cannot just create systems that are not interoperable, they can't talk to each other. And this will further reinforce the data standards movement and the importance of those data sharing agreements. So we're actually at a point in time that is a little bit of a watershed moment. Like we have changes in our health system with a full awareness of data and the problems, and we're all heading in the same direction. So there's a huge amount of potential and possibilities in this space. And so the question is, okay, what are we going to do about that? And how might we take these really big steps forward in what is still an extraordinarily complex ecosystem? The good news is there's a whole bunch of options out there, right? There's a bunch of tools, and I'm going to be talking, as per the title, and this has been a roundabout way to get there, about federated data systems. Federated systems are one part of the puzzle, one piece. It's not everything. It's not going to be the right answer for every problem case or every system or every jurisdiction, but is a really interesting one. So I'll be focusing on that. But I didn't want to come in and kind of leave the impression that this is a silver bullet, this fixes everything. There's each part of our complex system does need to be looked at. The good news again is there are tools, there are frameworks that can be used to kind of move things forward. There are vendors you can work with, but there's also open source. I'm a pretty big open source and open data proponent. A lot of the solutions that are being kind of developed by private industry and sold back to governments and health organizations and everyone else is actually built largely on open source frameworks, right? It's built on tools that are readily available. We have the opportunity to do this ourselves, right? We have the opportunity to make use of the same tools, to build and architect things that can not just solve our local business needs, but that can be shared, right? If we built, and we've done some of this in the public health agency, like we built an API for wastewater data that could be picked up and used anywhere around the world, right? It's built off data standards. It allows us to pull data in from 60 plus sites all across Canada, integrate it, aggregate it, and then set it up for analysis and set it up for visualization. So this is my mandatory open source plug. Open source is wonderful, and where you have common problems and the need for community action, I think there's huge potential in this space. But so what the heck is a federated data system? So federated means a lot of different things. So effectively what this means in this space is we have a system where you have a number of different jurisdictions. They retain control of their data, right? But through an intermediated, like here it says API gateway, this could be a single front door. Other folks have got access to the parts of that data that they need to do their work. This is all governed, right? It is well managed, it's well run, there's logging. So everyone kind of knows what's happening, but the system is set up so that you don't need to share data, right? Instead, what you're doing is you're providing approved queries that can be asked on the data that are well governed that will then give, again, everybody in the system what they need to actually do their work without messing with people's privacy, without needing to be concerned about what happens to data after it is shared from one system to another. And with this governance structure in place, you can actually have a lot more trust, right? And you can work more easily across systems. So this is the concept, and we'll dig into exactly what that means and how it looks. One of the pieces that's necessary to achieve this is actually thinking about what is the data we're talking about. And again, this kind of system could not have existed 20 years ago. It has requirements, right? You do need to be using cloud, right? You do need to think about how do you provide ready access to data. So it's not just, this data can be accessed when one person in one building, clicks a button or clicks send. So it involves the use of application program interfaces, APIs. It involves the use of streaming data. It requires metadata. It requires thinking about how we're architecting our systems and how we're providing access to them and findability, right? So you've got the FAIR principles that are there. And then it involves actually to have all of this in place, you can't be relying on like a human governance table for every step along the way. You actually need to build the governance into the code, into the applications, right? And it can be tweaked by different jurisdictions in the way that it needs. But it's not, okay, well, in order for us to provide access to this data, or in order for us to answer this query, you need to wait for the board meeting that's happening 3 weeks Tuesday, right? So it really changes a lot of the ways that we think about data and what we're doing. So we talked a little bit about what federation is. Why is this actually interesting to us? So I'm going to kind of turn this around. I'm going to start at the bottom here. Uh, there is and like the Pan-Canadian Health Data Strategy, like the reports that we're feeding into that, they highlighted the privacy chill, right? The fact that there is, if you are a jurisdiction, if you're working in the province or territory, and somebody asks for your data and they ask you to share your data, or if you're working in a hospital or any other care environment, it's almost always better to say no because of personal, like just incentives. Because if you say yes, what if something goes wrong? There's a lot of fear, uncertainty, and doubt. What if the person you share the data with has a data breach? What if somebody gets access to it? What if, something goes wrong and an email gets forwarded? There's all sorts of what ifs that even in the absence of legislation prohibiting data sharing, like the incentives aren't there. So we work often within our organizations, we will have systems where you will not share data unless somebody can show that they've jumped through all of these different hoops. What if we could turn that around to say, well, you will share data except where like some of these challenges are actually real, and federated data helps to sidestep those challenges, right? So again, you're not sharing the data, right? Somebody's got a query, you know exactly what that query is. You've got credentials, you know exactly who's asking, and you can say, yes, we will provide these fields in these circumstances to these parties, and then they can get things done. This can also serve to kind of sidestep a lot of the political fear around data sharing, right? Because often, like you might have a privacy czar within your jurisdiction who is doing their job, and you've got your data custodians who are thinking they need to lock things down. But there's also a political element to who are we sharing data with? What are they going to do with it? What if it makes us look bad? You can actually structure the queries in a way so that those things are not problems, right? And that helps us to get to action a lot better. Again, security we've already talked about real-time data, we've talked about automation, and then kind of the ability that once you've architected a system like this, there are costs, like cloud costs are real and need to be figured in, but you can turn it on and you can set it up so that when you need more resources, those resources are available, and you've got a lot of potential there. So we've been looking at this. So again, I'm at the Public Health Agency of Canada. So we've been looking at this at the federal level. And so this is kind of the model that we have been considering, right? And talking about and trying to socialize. And this is kind of the core of what we're talking about today. What if we actually had a federated data system in Canada that considered data would live within jurisdictions at potentially even at the point of care, but within this system, everyone had access to the data they needed to fulfill their, agreed upon role across the system. And this includes provinces and territories providing access to other provinces and territories. It includes the federal government. It considers the First Nations, Inuit and Métis, Indigenous data sovereignty rights and the control that they would rightly have over their own data, and like the permissions being actual permissions, right? We would say, yes, I will share this data with this party in under these circumstances. And it also considers, what about open data? What about citizen data scientists? What about researchers? How do we enable, right? How do we actually enable our ecosystem versus thinking very locally about what my business needs are? So this was kind of the vision we put together, and we developed it over the course of several months. And there was a bunch of like discussion notes and other pieces to this, and it digs down. If anyone's interested, very, very happy to share anything. But I think it does provide an actually like inspiring vision of what we could do together when we're actually, aligned around some of the potentials. So, but all of this, like nice illustrations, don't actually do anything. So, how do you actually make this into something real? So one of them is, you make a nice graphic so people will pay attention, right? They'll look at it. It helps them to understand. It's a map, right? And maps help us to make sense of our environment, where we are in our environment. And it helps us to point out things that are like, yeah, I really am here and this is accurate. It also helps people to look at it and say, that's totally wrong, right? You need to redraw my part of the map and it needs to look like this. So that this consensual sense making together. Storytelling. And the little fugu there is on purpose. Um, the we tried to find a good analogy, right, or like a good story about what we're talking about with federated data. And we actually ended up sharing this and bring it up to ministers, and it really worked well. So I do want to share it with you. So the metaphor is that of a restaurant, right? Like you walk into a restaurant, and in the back there might be raw fugu, right? There might be shellfish, there might be nuts, there's all sorts of things. You can't just walk into the restaurant, walk into the back, and put whatever you want in your mouth, and then walk out. The raw elements of food in the restaurant is like line level personal health data, right? But you can't do that. You can't just go into any system and get access to that. Instead, what you do is you walk in and you sit down at a table and you're given a menu. And the menu is an intermediary, right? It tells you what you are entitled to have, in what portions, in what kind of mixture, and what composition, how it's going to look like. And in doing that, you know that you're going to get something that is tasty, it's going to meet your needs, it's going to be healthy or healthy-ish, depending on the restaurant, and it's going to be safe. Right. So this can be an actually really powerful metaphor to saying, okay, well, what if we could actually structure our systems in that way? And if you go kind of back one page, the data API gateway, that's the menu, right? So everything else, that's the kitchen. So it's out of reach. You can't touch it except through the menu. And then you've got the governance and everything kind of embedded at that space to make sure that what's on the menu is actually what people are prepared and ready and capable of serving. So sorry, there's more stuff there. We need to think through the ecosystem. Again, think about all the different elements and then think about the data stewardship principles, right? Like if the founding principle is lock down your data, make sure no one can touch it, it's going to be a really hard road to hoe to make things better. If we can frame the conversation around data stewardship and the need to create value, the need to actually achieve our objectives. Like for the Public Health Agency, it's to protect and promote the health of people in Canada, right? So how do we do that? We're one federal organization. We can't do it unless every other part of the ecosystem has got the data that they need to fulfill their role. So that's kind of the vision around that. So we started figuring out, okay, well, what do we need to do to actually make this into reality? And what we decided was we would develop a proof of concept. This was around immunization vaccination data. It was a priority within government. It remains a priority within government. And it allowed us to kind of do a couple of things. So we built a working proof of concept, which involved 14 jurisdictions, and I'll get into the details. We didn't do it in a vacuum, so we did it as part of several working groups and with a number of partners and exploring kind of what would work in this situation, what would work in a different one. We used it as the baseline for a piece of policy work, which was to develop recommendations for an ADM committee on public health data for data stewardship. So rather than developing the recommendations in a vacuum, we said, okay, what if we actually built a system that demonstrated this, that articulated the governance, that articulated the data stewardship needs, and then we actually did the policy work with an eye towards something real. So that's kind of what we're going to talk about, or what I'm going to talk about now. So you can see a couple of things, infrastructure and governance as code. We use synthetic patient data, so no real data was part of this. Doing prototypes using synthetic data, fake data, is a really easy way to showcase value while sidestepping again, well, what about privacy, security, all of these things, right? So you can do a lot of important work there. Um, we set it up for real-time data streaming across these different jurisdictions. We set up a governance GUI to show, like, you could actually control these things. And then we also built in analytics to show, okay, well, so what? What could we do if we had a system that worked like this? So I'm going to go through this. I think we're okay for time. So um, what what is governance as code, right? There's a movement called rules as code, which is phenomenally interesting. And it basically says that like the laws that we have effectively are a form of code, right? Like you even have things called like the criminal code. They are a structured set of instructions that guide decision making in different ways. And so there's the ability to actually set up data systems where not just governance can be, you need to talk to this committee before you can talk to that committee before somebody can say yes. Governance can also be, this is exactly how things will flow. This is how decisions are made. If you meet this threshold, it's a yes. If you fail to meet that threshold, it's a no. So you can actually set up data systems so that the governance is 100% transparent, embedded, understandable by anyone who wants to look at that system, and automated, right? So data can, with full governance, flow to exactly where it needs to be. So this was the idea here. So the proof of concept that we built had 14 different jurisdictions. So there was 13 provinces, territories, plus the federal government. Each one had data that was stored solely within its ambit, right? So it had basically its own compartmentalized section. It had all of its data, but we set up an automated like governance as code system so that data could flow according to these approved queries across all of the different systems. So I don't know if folks can see my okay, maybe you can see my cursor, but basically you've got in the yellow box the PTI federal health data sources. You had an extraction control mechanism. There was data analytics processing. Each PT had their own data analytics space. Then there was this governance space, and we could basically change the governance live, and it would kind of move across the system. So it just demonstrated that there's extraordinarily well, not easy, extraordinarily powerful ways to propagate decision making across the system. You could decide one day, okay, we're no longer providing access to this data, and within seconds it would be everywhere, rather than, oh, sorry, let's send a memo and let's wait for different parts of the system to kind of pick that up. Then through an access control gateway, you basically have the ability for each jurisdiction, province or territory, to query each other jurisdiction, and for the federal government, effectively, like in simulation, to also query jurisdictions and pull back data in aggregate, right? And then there was the normal kind of tooling around that. So this means everyone's got their data, everyone has got the opportunity to access data from others depending on the decisions that they make locally, and you've got the ability to pull it together and aggregate across the system. So the second item was synthetic data. This is actually really, really impressive work. There's a synthetic health data generation service out of the US called Cynthia. So we use that as kind of the basis of this. But then the team started using open source available data from census, from like geocoding, of where different health organizations are, cost data from care providers and hospitals, um, socio-demographic data across geographic areas, and they pulled it all together. So effectively, we had 1,000 patient records per province and territory. Each of them was a full patient file, right? It had all the immunization data. It had, synthetically generated visits to healthcare providers across a number of different settings. It tracked kind of where these little synthetic people would go just based off like distance and travel time. It's a really powerful set, which again helped us to better explain the value coming out of this system. We set it up for streaming data, right? So the idea and what you're seeing here is the synthetic data kind of lighting up in the system. This is focused on vaccinations, so total yearly vaccinations per province and territory. So you should be able to see kind of like the little lines kind of popping up. This is actually really important, and we live in a period of time when folks want answers. and they want answers really, really quickly. And if we, as a federal, the public health agency, can't provide them, one, it calls our actual like capability into question, or it causes trust to degrade. Like, why aren't they providing this? Of course, they must know how many vaccines were provided in this area at this point in time. And it doesn't matter that the systems are complex or we have data silos or things are difficult. What, what matters is like we're not credible. So having kind of real time and planning for this can actually be extraordinarily important to you, no matter where you are in the system. This is just an image of the governance GUI. So basically what you could do is like this shows kind of starting to go down and saying, okay, well, I want to create a query for vaccination. So vaccination by organization. You can go down and for each field within your local data set, which aligns to the FHIR standard, by the way, so FHIR HL7, you could say, I'm going to share this, I'm not going to share that. Or I'm going to hash this data, or I'm going to transform this data in this way. So I'm not going to provide the full postal code. I'm going to provide the first 3 digits or first 2 digits, depending on how you want to protect privacy. So we actually built this to show that jurisdiction by jurisdiction, you can control data access, right? And only the things that you say you want to share and agree to and build into your governance mechanism actually will get moved. The analytics suite, again, you've just got kind of a quick little view of this here, but we asked, common to us, and we were data, not necessarily like grounded public health professionals, like, well, who missed their vaccinations? How far did they need to travel? Why did they miss it? We set it up in ways like the 2 maps along the bottom. One of them, the one on the left, shows BC, and there you could actually drill down to say, oh, we're missing like 5 children who did not get vaccinated within this jurisdiction. The map on the right shows what a federal level might look like. We don't know the details. We don't have access to the specifics. We don't know the people, but we have the high level, national trend to know where interventions might be needed and to work better with partners. So proof of concept was built up. It ran quite well. We used it through this process. It has since been shut down. All of the code, however, is live or is still live, available up on GitHub. Very happy to share that as well with anyone who's interested. So talked a lot about federated data. I think that there's a lot of important stuff to it. There's a lot of opportunity here. It's not something that you can just kind of go in and say, okay, yeah, we've decided we're doing this. We're going to turn it on and away you go. This does require high levels of technical expertise. It requires access to people that can be hard to find, hard to hire, hard to retain, and that need the right tools within your organization to do this work. So within very hierarchical organizations or within organizations where it might be hard to get access to cloud or streaming tools and like where procurement can be major issues, this stuff can be difficult. This doesn't do anything about data quality, right? Like having an amazing, even if we had this fantastic federated system at the jurisdiction and federal level, if you don't have good data coming in from the points of care, and you don't have the standards and you don't have the way that this data needs to flow through those systems, you're not going to see the value that you need coming out of it. And then finally, like all of this, everyone who's doing a talk on health data will say it's not about the technology. It's not up until the technology becomes very important, but the people are always going to be more important. The relationships, the trust, the politics across our system, right? And how we can actually move people together. So there's tons of work to do, but I think there's real reasons for optimism as we're moving through this space. This is just my other mea culpa. Like there's a bunch of other stuff I haven't talked about here. It's all important. Intersectional data, like how do we actually think about lived experience across this? Power around who is defining like the questions around data, who's collecting it, who has opportunities to question that, who's pushing back. Like the power is part of all of this and it's part of all of our systems. So I think we really need to look at that and AI as not a silver bullet, but something that definitely does need to be considered. So just wanted to kind of share those. So again, thank you so much for your time. 3 things to kind of think about or remember. Maybe we don't need to share our data. And maybe by not sharing our data, we can actually do a better job and enable the ecosystem in more powerful ways. 2, data is not valuable unless people are using it. We really do need to kind of change the discussion we have and shift from a lock it down mentality to how can my data help other people achieve our communal and community goals. And then 3, there are ways and opportunities that we can do this better. So let's work together to kind of figure out what that is. So thank you so much for your time.